If you look just at the type of response that a cell exhibits during damage, whatever stress the cell undergoes, there's a very complex pathway, but more or less a similar pathway of response to the injury, to the insult, if you will. As you look at those, what we realize is that we do find more and more components of the system, but we're not necessarily able to quantify exactly the relationships and the timing of these molecular effects during the response. It's not unlike studying, if you will, a computer chip. If you knew nothing about computer chips and you discovered one day, 1,000 years from now, or 100,000 years from now, and you're a scientist, and you're trying to figure out what humans were doing with this chip, the first thing you would do would be to understand the components of the chip, transistors and resistors and so on. But at the end of the day, you will not understand the system unless you understood the software that was being used. How did you write a document? How did you create a slide? This is where science is. We're really moving from a stage where we understood the components or the hardware of life to understanding and trying to unravel the software of life. And this is where a lot of the efforts are going to be, both in industry and in science, trying to understand this, the software by understanding the molecular pathways and the regulation in health and disease. That is, I'm just giving you what I consider the major trends that I have observed and where a lot of investment need to be done. Now, having said so, it is also true that we're witnessing an explosion of knowledge. I'm showing you here a slide that I have made when I was NIH director. I asked for all my institutes to report genomic discoveries to the director's office on a regular basis. So every month I would get a report. And the reason I did this was because in 2003 we finished the sequencing of the human genome. And I had a lot of questions from many policymakers saying, so what's next? How are we going to exploit this human genome? What diseases are you going to cure tomorrow? And how should we increase or not increase the budget of the National Institutes of Health? So you have to make a strong case. So I decided to map all of our discoveries in terms of genomics and disease through what we call genome-wide association studies, which we launched in 2003. In 2003, there were no discoveries. In 2004, there were no discoveries. In 2005, again, we were still working on it. The technology of sequencing had made huge progress, which allowed us to study more diseases with comparing patients and healthy patients. So in 2005, this was the map. One discovery on chromosome 1. Now, all these bars are the chromosomes of the human cell, all the way to X and Y at the end. So we locate, for example, on chromosome 1, a finding. This was the finding related to age-related macular degeneration. And at that time, it was thought to be a neurodegenerative disease until an abnormality of factor H, which is an inflammatory factor in the blood, was discovered, which changed completely our understanding of this disease from a degenerative disease to an inflammatory immune response disease. In 2006, 3 more discoveries were made, so I was very happy to go to Congress and say, we have tripled our productivity. We have now found 3 markers of disease related to heart disease, related to inflammatory bowel disease. And then in 2007, we had 6 more in the first quarter of 2007. So I went back and reported again that we had doubled our productivity from the first year of 2006. And now I'm going to show you all the findings that have been reported to me. Here's the second quarter of 2007. Here's the third quarter. Here's the fourth quarter. Here's 2008. By quarter, the map is just not large enough now it's not large enough now to really be representative or be represented easily. We have over 150 different associations and pathways to be examined. Now, an association doesn't mean a causation, so we still have to do a lot more work. But we've never had so many opportunities to unravel the underlying complexity of biology, both in health and disease, as we've had in this past 2 years. So I think there is a need for renewed approaches and different approaches and smart approaches, which I think give an advantage to those who want to really go into this with a different mindset than the traditional mindset. Having said that, what is the industry challenge to complete my presentation to you? I think there is a problem in terms of the pipeline, in terms of innovation and productivity. And you need to redefine core competencies in industry as well. And the key there is to understand that one disease, one product, one major blockbuster is not going to be the solution. You're going to have to develop a family of products that attack the disease differently, because the disease that you think is one disease may actually be 5 or 10 diseases. So I predict, for example, that today we have type 1 and type 2 diabetes, but I think in the future we'll have type 1 and 2 and 3 and 4 and 5 and 6, depending upon the biomarkers that are subclassifying the types of underlying abnormalities that we have to understand. And there will be a major shift in market demands and response strategies. And what does that mean? That means that truly, as you look at the productivity today of biotechnology and industry, what you see is a rapid decrease in the number of new molecular entities that are being produced, even though industry and pharmacology and pharmaceutical companies and biotechnology companies spend 3 times as much as governments in terms of developing new biologicals and new molecular entities. So there is a need there. It's going to be overcome, but clearly that need will require a better understanding of disease processes, and we're already doing this. For example, in cancer, there is a gene chip that can identify patients with breast cancer who will respond to chemotherapy and those who will not. And that is an enormous change in the way we treat disease, because now, even though it's called breast cancer, we know we have many subtypes that need to be treated differently and managed differently based on these biomarkers. The same is true across many other diseases, but the strategic question that opinion leaders have to ask themselves is this sustainable? If we fragment diseases in so many subcategories, is any drug going to be effective? How can you maintain the economics of pharmaceuticals and biotechnology? And the answer is, what we're also finding in these pathways is that although you may have disease 1 and 2 and 3, some of which look exactly the same, you'll see that there are common, I don't have a pointer to show you, but you can see there are common molecules that, or particular nodes in the network that are common to several diseases. So that it's clear that to intervene, you may have to use drug 1, 5, and 12 for disease X, and then 4, 7, and 8. So you may have more uses for one molecule than you do currently if you just attack one disease. What I'm saying there is that at the end of the day, the market structure of industry has to be equal or mirroring the underlying molecular structure of disease pathways. At the end of the day, that's what you need to do. So the answer, therefore, depends entirely on the molecular mechanism of disease, which are becoming more and more discovered and discoverable. And in genomics, for example, we will have to understand the subclassifications and rebalance the actions of these molecular pathways through multiple pharmaceuticals.